Welcome. This is a talk about acne. Acne is a very common skin disease in Western societies. It mainly affects teenagers and young adults. However, in some people, it can grumble on into their 30s and 40s. Acne is a disease of Western societies that is associated with the Western diet. This is the usual clinical picture when a teenager or young adult presents with acne. There are quite a few pimples and some blackheads and whiteheads present. There are also quite a few purplish stains present. These are due to previous pimples that have dried up. Acne is a disease of oil glands. The technical term for these is sebaceous glands. Sebaceous glands respond to hormones, especially testosterone. When puberty arrives, testosterone levels rise and oil glands start to proliferate. They also produce more oil. The first step in the cause of acne is blockage of the oil glands. The oil glands are blocked by dead skin. No one is sure why this occurs, but once the oil gland is blocked, the oil behind the blockage is still produced and the oil gland starts to swell. Bacteria also proliferate in the blocked oil glands and change the composition of the oil. If an oil gland breaks, the oil will get into the skin and it will cause inflammation. It will cause redness, swelling, and pus. You should be aware that oil on the skin protects the skin. Oil in the skin can cause inflammation. Shows the sequence of events in the genesis of acne. You should be aware that there is no dirt in a blackhead. A blackhead consists of packed dead skin cells. Over time, the dead skin cells darken in colour. The blocked oil glands are a breeding ground for bacteria. The bacteria change the composition of the oil. A breakage in the oil gland leads to leakage of the irritating oil into the skin and a pimple develops. Acne is a disease of Western societies. When young people migrate from the third world and start adopting the habits and diet of the first world, acne develops. If the migrants return to their countries of origin and resume the diet in the country of origin, acne improves. Studies in Melbourne and in Taiwan have shown that acne patients who change their diets notice an improvement in the acne. It's also been noted that people with acne who starve find that the acne improves. However, starvation is not recommended as a treatment for acne. People think that acne is only a disease of teenagers, but this is not true. It grumbles on in a large percentage of older people. A United States survey of people aged 25 years or more found that 54% of women and 40% of men had some acne. This appears to be related to the United States diet. In the US, foods that have a high glycemic index comprise 47% of the average person's energy intake. The glycemic index is a measure of the ability of a food to raise blood sugar. If blood sugar is raised, insulin is produced, and insulin is involved in the genesis of acne. There are websites that will give the glycemic index of different foods, but in general, refined grains and refined sugars have a high glycemic index. Unprocessed fruit or unprocessed vegetables or whole grain bread have low glycemic index. The diet influences hormones that regulate sebaceous gland function. Insulin is one of the most important hormones in this regard. High blood sugar leads to high insulin production. Insulin has an influence over other hormones that affect sebaceous glands. Sebaceous glands become bigger and produce more oil. Some of the glands will become blocked, obstructed, swell, break, etc. And the result is acne. Increased oil production is central to the genesis of acne. The technical term for oil is sebum. A low glycemic index diet decreases sebum production. This is because a low GI diet is associated with low insulin production, and insulin is important in the genesis of acne. The diet not only influences the amount of sebum that's produced, but it also influences the composition of sebum. The Western diet of high glycemic index foods promotes increased insulin production or hyperinsulinemia. Insulin promotes acne. The Western diet also promotes inflammation. The ratio of polyunsaturated fatty acids W6 to W3 is high in the Western diet. In the typical Western diet, the ratio is about 10 to 1. The W6 polyunsaturated fatty acids promote inflammation, whereas the W3 polyunsaturated fatty acids reduce inflammation. The high ratio of W6 to W3 polyunsaturated fatty acids in the Western diet promotes inflammation throughout the body. It also means that the sebum produced by somebody on a Western diet is far more irritating than if the diet was low in glycemic index foods. The Western diet leads to increased production of insulin, which is secreted into the blood. Insulin in high levels promotes acne. It is the entire Western diet, not just chocolate, as most people think. Diets that improve acne are available on the internet. In summary, the diets mean no refined flour, but wholemeal flour is allowed. No added sugar, that means no soft drinks. Only small amount of dairy product is allowed. The amount of protein in the diet has to be increased, and the amount of fat has to be reduced. Remember, omega-3 fatty acids are good, omega-6 fatty acids are bad. The pictures show how effective the anti-acne diet is. The patients did not receive any other treatment but changed their diets, and you can see after 12 weeks there are far fewer pimples and blackheads. The anti-acne diet works. This was proved in an Australian study and also in a Taiwanese study of adolescents who had acne but modified their diets. Patients with a high BMI are more likely to have acne and more likely to have severe acne than usual. Losing weight leads to improvement in acne. In summary, acne is a disease of Western civilization because of our diet. If people do not want to change their diets, there are treatments available that will improve acne or even clear it. The treatments that are available are anti-inflammatory antibiotics, anti-androgens, isotretinoin, and creams that remove blackheads and whiteheads or comedonlytics. Sun exposure will also improve the appearance of acne and maybe even clear it. However, don't get sunburned. Most patients with acne will clear if they take an anti-inflammatory antibiotic and apply a comedonlytic. Not all antibiotics have anti-inflammatory properties. Anti-inflammatory antibiotics work not just by killing germs but also their chemical ability to reduce inflammation. There are many comedonlytics on the market. Some are less irritating than others. Most are equally effective. The face can be washed with soap and water because there is no dirt in the blackhead. It is compressed skin that's causing the dark colour. No greasy product should be placed on the skin or the scalp because they can block the pores. People touch their scalps a lot and then rub their fingers over their faces. This will transmit greasy products from the scalp to the skin and aggravate acne. As mentioned before, if people want to lead a normal social life, they should eat what their friends eat. The anti-acne diet is very restrictive. There are several comedonlytics available. Some of them can irritate the skin if they're left on too long to begin with. Patients should slowly increase the time that the comedonlytic is left on the skin. I suggest applying it for half an hour a night for the first week and then doubling the time each week. The aim is to leave the comedonlytic on overnight. Some patients respond better to a combination of comedonlytics. However, the combination might be more irritating than either alone. The dose of the antibiotic with anti-inflammatory properties has to be adequate. For the average size teenager or young adult, an adequate dose is 1 gram of tetracycline a day, or 200 milligrams of vancomycin a day, or 200 milligrams of minomycin a day, or 2 sulfur tablets a day. The sulfur tablets usually come in combination with trimethoprim, and the combination is called co-trimoxazole. As soon as the pimples dry up and flatten, the dose can be reduced. Erythromycin is less effective, but erythromycin can be taken by pregnant women. The other anti-inflammatory antibiotics mentioned in the previous slide cannot. Topical antibiotics such as clindamycin lotion are less effective because little of the drug penetrates deep into the skin where the inflammation is occurring. The drug dapsone is effective. Some people with bad acne respond well to a combination of different antibiotics with anti-inflammatory properties. The picture shows a young man who had severe acne that did not respond to isotretinoin. He was commenced on dapsone and had a very good response, as the bottom picture shows. When the pimples dry up and flatten, there may be stains left behind. This woman's acne cleared after she took 200 milligrams of minomycin a day for a month. All the stains were flat, and after getting out into the sun and getting a tan, she was left with no stains and no scars. Tetracyclines, vancomycin or minomycin cannot be taken by children. The drug gets into the enamel of forming teeth and leaves a stain. The teeth of this adolescent show the grey-yellow stain because the child was prescribed tetracycline during childhood. The slide shows a woman who has persistent acne affecting mainly the chin. Chin acne tends to occur more often in women and it persists. Most women without treatment will not grow out of it until they are in their 30s or maybe even 40s. Without treatment, by the time they grow out of it, they'll be left with a lot of scars. This teenager has many blackheads but only a few pimples. His face cleared when he applied a comedonlytic. He started with benzoyl peroxide and it was sufficient to clear his skin. If benzoyl peroxide was not working on its own, retinoic acid could be added because the combination works better than either alone. If he developed more pimples, he would be prescribed an anti-inflammatory antibiotic. The picture shows a young man with severe acne. He doesn't just have pimples, he has cysts caused by inflammation. The cysts will heal, but they'll leave scars. Severe acne runs in families. It should be treated straight away to prevent scar formation. Patients with severe acne should be treated with isotretinoin because it is the most effective drug to treat acne. It is a form of vitamin A. It is similar in structure to vitamin A, but it is less toxic in the dose needed to treat acne than vitamin A is. Vitamin A in a dose needed to treat bad acne is 4 times as toxic as isotretinoin. The course is for 5 months. The dose should be 1 milligram of isotretinoin per kilogram of patient weight per day. There are side effects, but in most cases these are not too severe, and in the overwhelming majority of patients the side effects are well tolerated. The most common side effect with isotretinoin therapy is dryness, especially dryness of the lips. Dry lips occur in everyone who takes it. Some people develop dryness in the nose and might experience nosebleeds. Some people have dry skin, and some people experience dry mouth, but this is not common. Isotretinoin, like a high dose of vitamin A, is a teratogen. It causes birth defects. However, the drug is eliminated from the body within 1 month of finishing therapy. There is a concern that isotretinoin therapy can cause depression. The drug has been available since 1978, and millions of teenagers and young adults have taken it since then. Studies of large groups of patients who took the drug have not found that it causes depression. This young man had severe cystic acne and he was treated with isotretinoin. His skin cleared, but he was left with a few scars. At the end of the treatment, he was happy because he had no acne. Studies of large groups of teenagers and young adults have found that those who've had acne and who have cleared their acne are a lot happier. This picture is the back of a 14-year-old boy who presented with severe cystic acne. The fact that the bad acne occurred at such a young age was a great concern. He was treated with isotretinoin and the acne cleared up. Unfortunately, many of the cysts left scars after they healed. However, he never had bad acne again. Long-term follow-up of patients with acne have found that those who take the full course of isotretinoin do not get such severe acne again. Only 2% of patients have to take another course because they start getting acne and some cysts. The second course of isotretinoin is effective and usually induces a very long remission. Cyproterone acetate blocks male hormone. It is an anti-androgen. It is suitable treatment for women with acne, but it's not recommended for men as a treatment for acne. The dose is 50 milligrams a day for 10 days a month, that is days 5 to 14 of the menstrual cycle. The pill should be taken as well in order to keep the menstrual cycle regular. If cyproterone acetate is taken on its own, there might be breakthrough bleeding in the second half of the menstrual cycle. This is a painting of a gentleman with rosacea. Rosacea looks like acne, but it's not acne. Patients have redness and lesions that look like pimples. They do not have any blackheads. This is a picture of an elderly man with pretty bad rosacea. He had lesions that looked like pimples, but he had no blackheads. Rosacea is a disease of middle-aged and elderly people. Acne is a disease of teenagers and young adults. Rosacea looks like acne, but it's not due to sebaceous glands enlarging and breaking. Rosacea is due to blood vessels in the skin leaking fluid. The blood vessels have opened up, hence the redness. When gaps appear in the blood vessels, fluid leaks out and the collections of fluid look like pimples. Treatment consists of taking an anti-inflammatory antibiotic in an adequate dose. Rosacea is aggravated by sun exposure. Patients should apply a sunscreen of adequate SPF every day of the year to reduce sun damage and therefore reduce rosacea. A rosacea-like eruption on the face can be caused by using strong cortisone creams on the face. The strong creams are fluorinated or chlorinated glucocorticosteroid creams. If they are applied for too long, they thin the skin. The thin skin means the blood vessels open up, the blood vessels leak fluid, and a rosacea-like eruption develops. The treatment is an anti-inflammatory antibiotic in an adequate dose. Only 1% hydrocortisone cream is safe to apply to the face for long periods of time. Any other form of cortisone cannot be applied to the face for long periods without damaging the skin. The pictures show a complication of rosacea called rhinophyma. The increased blood flow in the skin leads to proliferation of the skin's tissue and affects mainly the nose. The nose becomes big and bulbous. Nowadays, with adequate treatment of rosacea, rhinophyma is becoming less common. If a patient has rosacea and rhinophyma, the rosacea has to be treated. The patient needs to take an anti-inflammatory antibiotic of adequate strength. The patient has to protect himself from the sun. Contrary to popular belief, rosacea is not due to alcoholism. Alcohol consumption in moderation is okay. The rhinophyma, if it causes a lot of embarrassment to the patient, may need to be repaired. This patient had rosacea and early rhinophyma. The rosacea cleared with therapy. However, the skin on the sides of his nose was thick and red. It was causing him embarrassment. The rhinophyma was repaired. The excess skin was removed with a carbon dioxide laser. His appearance is much improved and he was not left with a scar. In summary, acne, even bad acne, can be successfully treated. Rosacea can be successfully treated, and rhinophyma can be successfully repaired. Thank you for your attention.